Hi, welcome to my channel. So let's get right into it. So, does hepatomegaly, does right-sided heart failure cause hepatomegaly, or is it left-sided heart failure? So let's get into it. Now, in order for you to really understand the pathophysiology of how a patient would end up with hepatomegaly, you first have to understand the normal pathway of blood in the heart. I'm not really about memorizing, left for lungs, this, that, and the third. I want you to understand how blood flows. Once you understand how blood flows, then if someone has a valve pathology or they have some other pathology that is responsible for them having heart failure or something bad happening with the heart, you will be able to, in your mind, figure out, just because you know how blood flows normally in the heart. So before I get to that, I want to first talk about how blood flows normally. So blood goes from the SVC to the right atrium. From the right atrium, it goes into the right ventricle via the tricuspid valve. Okay, so from the right ventricle, it's going to go through the pulmonic valve. From the pulmonic valve, it's going to go to the pulmonary artery. So just in case you didn't know, the pulmonary artery is the only artery in the body that carries deoxygenated blood. So just in case you didn't know, you learned that from me. All right, now let's go. So from the pulmonary artery, blood goes to the lungs where it gets oxygenated, right? So after it gets oxygenated, then it goes to the pulmonary vein. From the pulmonary vein, it goes to the left atrium. From the left atrium, it goes to the mitral valve into the left ventricle. And from the left ventricle, it goes through the aortic valve up to the aorta. Now, let's talk about pathology. So once you understand that the tricuspid valve is between the right atrium and the right ventricle, and the mitral valve is between the left atrium and the left ventricle, you can start to visualize things as I'm explaining it to you. Okay, so let's say this patient has pulmonary hypertension, high blood pressure in the lungs. So what happens is, when that pulmonary artery is trying to push blood into the lungs so that it can get oxygenated, what happens is that that pulmonary artery is meeting a lot of resistance. So what happens as a result of this increased resistance, blood starts backing up. Where does it go? Let me take you there. So it goes from the pulmonary artery all the way down back to the right ventricle, right? So when you have patients that have like chronic pulmonary hypertension, what happens is you have constant backflow of blood into the right ventricle. So when this happens, these patients will end up having right ventricular dysfunction or right ventricular enlargement, okay? Or RV failure. Now, what ends up happening is blood is going to go back from the right ventricle through the tricuspid valve into the right atrium, right? So once it gets to the right atrium, now it's going to travel back to the SVC. So once you have all this blood in the SVC, what happens is you end up getting what you call here JVD, right? So this JVD is the reason why you get JVD is because your SVC is full of a lot of blood. Okay, so now what ends up happening is that blood goes from the SVC and travels to the inferior vena cava. So once blood now backs up to the superior vena cava, now it's in the inferior vena cava, what happens is it causes the liver to become enlarged. So this is all as a result of having backflow of blood. So now what ends up happening when this happens on a consistent and chronic basis, you end up getting hepatomegaly, or what you know as enlarged liver. So then this progresses to cardiac ascites. Now you start getting fluid in the abdomen. And this is why patients who have heart failure often need a paracentesis, right? Okay, then you will get further back up, right? So then this heart failure progresses now where you have fluid in your legs, in your ankles. And it could be pitting or non-pitting, just meaning that when you press down, you leave an imprint. Other times you don't need to leave an imprint. They're just swollen because they're not pitting. They're just edematous. Okay? I hope you got the gist of this video. The purpose for me in these videos is not really to have you understand no left phalanx, blah, blah, blah. I want you to understand how things actually move through the heart so that if it has some sort of pathology, you can think about that just by knowing the anatomy and how things flow to understand, okay, well, this patient probably will have this. Let me give you an example. If you understand that, okay, between the right atrium and the right ventricle is a tricuspid valve. So if somebody has, for example, tricuspid regurgitation, what's the difference between tricuspid regurgitation and tricuspid stenosis? The difference is regurgitation is an issue with the valves closing properly. So they don't close all the way, right? So what happens is when the ventricle contracts, blood just goes back. And stenosis is when the valves don't open correctly, right? So if you think about it, if somebody has, for example, tricuspid regurgitation, what's gonna happen is that valve is not closing, so blood is just gonna go back. So what do you anticipate the signs and symptoms that this patient will have from tricuspid regurgitation? So think, oh, going back, where's it gonna go? Into the right atrium, causing right atrial enlargement. So then knowing what happens with right-sided heart failure, you're gonna say, oh, well, patients who have severe tricuspid valve regurgitation should have signs of hepatomegaly, JVD, and these are all things that you, by yourself, can figure out just because you understand how the blood flows normally. And this is why I'm big on understanding that versus just trying to memorize symptoms and signs, because you can forget. But if you understand how normal blood flows, you will absolutely not ever forget. Okay, I hope I got my point across. So make sure you subscribe to my channel. There's a lot of stuff that I got in this brain that I want to teach you. I will have much more information for you. Moving forward, there will be a video on left-sided heart failure, and there will be another video on how nurses can manage heart failure patients when they're admitted. Like, how do you as a nurse know that this patient is improving? How do you know that this patient, the medications that are ordered for this patient is actually working? What are some subjective signs? What are some objective signs? These are some things that will be able to help you take care of the patient better. Anyway, I will talk to you soon. Bye.